Hi everyone, today is World Tuberculosis Day. Tuberculosis is also referred to as TB. So for the purpose of this video, I am going to refer to tuberculosis as TB. I'm going to be talking about the effect of tuberculosis on infertility. And this video is in collaboration with a charity organization, a non-profit organization called Visit a Hospital Today. This organization is doing amazing work helping people that can't afford hospital bills to raise funds to pay for their hospital bills, surgeries, chronic conditions, and anything that you need to do in the hospital but can't afford to do it. I am so honored to be collaborating with them to create awareness on the effect of tuberculosis on infertility. If you're new to my channel, I am Dr. Amarachi Ijeoma. I am a fertility physician and my channel focuses on everything fertility and women's health. So if you want more content like this, subscribe to my channel, like this video, and if you have questions, drop it in the comment section below. TB is a potentially serious infection that affects the lungs. It is a bacterial infection that is spread from person to person through tiny droplets when you cough or sneeze. Well, the person has to actively have tuberculosis. But then, how do you know that you have tuberculosis? There are signs and symptoms to know this. When you're having chronic cough for about 3 weeks, you're coughing blood or mucus, you're having drenching night sweats. When I mean drenching night sweats, I mean in the night you're soaked, like your body is soaked. You can literally squeeze out the sweat from your clothes at night. Or you're having fever that refuses to go, or chest pain when you cough or breathe, or unexplained weight loss, fatigue, loss of appetite, and chills. So you don't necessarily have to have all of these symptoms together, but when you have some of these symptoms, especially when the cough has lasted for up to 3 weeks, you want to go and see your doctor. A lot of us have immune systems that can actually fight the TB bacteria. So when you have like a good immune system, you exercise, you eat healthy, your vegetables, your fruits, you don't have any chronic infections like diabetes, HIV, or any cancers, any other like chronic infections that can potentially reduce your immune system, then yes, our bodies can actually fight this thing. But then sometimes when you realize that you're living with somebody that has active tuberculosis, you also want to take precautionary measures to avoid getting infected. TB can get complicated. The bacteria can pass through the blood and then get to the kidneys and compromise the kidneys, your spine, your brain, and even your uterus, which is your womb. So when the TB affects your uterus, it's called uterine tuberculosis or pelvic TB. And when this occurs, it can affect fertility. 1, when it gets to the uterus, it can cause the lining of your uterus to be very thin. So you see, at some point in your menstrual cycle, your uterine lining, that's the inner part of your womb, the lining is supposed to be thick enough to receive an embryo so the embryo can implant. So this tuberculosis, what it does is it can cause the lining to be really thin, thereby preventing proper implantation or even preventing implantation at all. But if implantation occurs, it can also lead to miscarriage because it's not thick enough to hold the embryo. TB can also affect the fallopian tubes. And when TB affects the fallopian tubes, it can actually affect fertilization because you know how the anatomy of the body is, right? So the egg is getting released into the fallopian tube, waiting for the sperm to come and fertilize it. But when the fallopian tube is compromised, it can actually compromise that whole process of fertilization and movement of the embryo through the fallopian tube into the uterus. Tuberculosis can also affect male infertility. How does it do this? It can affect the reproductive organs of males. It can affect the testes, the epididymis, the vas deferens. It can affect the reproductive tract of males and can lead to infertility. So what do you do to prevent this? 1, if you're someone that has tuberculosis, when you cough, please cough into a toilet paper, a tissue paper, and then fold it neatly. put it inside a bag and seal it and dispose the bag. Always make sure that you're not in crowded places. Make sure that whatever room you are is well ventilated. Cross ventilation is key, by the way. So you want to have like windows, like 2 windows in the room where like there's air coming in. So you want the room to be well ventilated, because you see this bacteria, it thrives in not well ventilated spaces. If you absolutely must go out, then wear your face mask to avoid transmitting, because when you laugh, when you sing, when you cough, when you sneeze, you can release these droplets that can actually spread from person to person. If you can stay at home, please stay at home. Treatments usually last for months. After completing these months, you'll be asked to redo your tuberculosis test, and if you're free to go, then voila, that's a good thing. Unfortunately, Nigeria is ranked top 10 countries in the world with the highest TB burden. So if you give birth to your child in Nigeria, your child will be expected to get the BCG vaccine. This is the vaccine against tuberculosis. Most importantly, exercise, eat healthy, take your medications, and apply all the preventive measures to prevent spread from person to person. Stay healthy, guys, and see you in my next video.